So I often get asked, hey doc, why do I really have to take care of my mouth, my teeth, and my gums? And the real answer really is that your mouth is the gateway to your overall health. Generally speaking, the healthier your mouth is, the more likely the healthier your overall body will be. Now, the two most prevalent diseases in the mouth, and in fact, most prevalent diseases worldwide, are tooth decay and gum disease. Now, gum disease is broken down into two subcategories. One is gingivitis and one is periodontal disease. And the big difference is that gingivitis is inflammation of the gums. It's bacteria that causes the inflammation and causes your gums to get red and pussy and bleedy, but it's reversible. Periodontal disease, on the other hand, is not reversible. Periodontal disease is the disease of the bone and gums of your teeth. When you have gum disease in that nature, where the bone is affected, that bone, once you've lost it from the bacteria, you don't grow that back. The only thing we can do at that point in time is try to prevent you from losing more bone. So for the purpose of this video, when I say gum disease, I am referring to periodontal disease. So let's start with the dental abscess, because when I refer to all the diseases I just mentioned with tooth decay and gum disease, the main crux of it is bacteria and inflammation. When you have a dental abscess and you do not treat it, that abscess can spread. And because that infection and inflammation is constantly there, it's going to drag down your immune system, making you more susceptible to other diseases. One severe possibility of a dental abscess is that bacteria leaks into your cellular tissue around your throat area, and you can develop something called Ludwigs Angina, which closes up your airway so you cannot breathe, and it is fatal. So you never want to leave a dental infection, because we do not want that to happen. When you have gingivitis, you have inflammation of the gums because the bacteria is in there, your gums get red. So basically, if you're flossing periodically and you notice that the gums are bleeding, it's because it's inflamed. So make sure you floss every day, because we do not want the gums to bleed, because that's gingivitis. And if untreated, gingivitis can progress to periodontal disease, which is much, much more severe. The more bone you lose, the harder it is to clean out the bacteria, because you can only get floss down under the gums 3 millimeters. So if you lose 4-5 millimeters of bone, you cannot get the rest of the bacteria out. So it's very important, if you have periodontal disease, to come in more frequently for your dental cleanings so we can get all the bacteria you cannot get out. So what happens if you don't treat the gum disease? Well, from a dental aspect, you're going to start to see your teeth start to loosen. You're going to get bad breath, start losing teeth. So all those are manifestations of the gum disease, and that's localized to the mouth. However, gum disease is a systemic problem. That means it affects your entire body. It drags down your immune system because it's constantly fighting all that bacteria in your mouth in a losing battle. And the reason for that is the bacteria in your mouth is sticky. It forms plaque. And plaque is very hard to get off. It doesn't just rinse off. You have to actually physically remove it. So it sticks there. If you don't get it off in a timely fashion, it'll actually harden and become something called calculus or tartar. And that causes your gums to be constantly inflamed because it can never fight the infection off. The other problem is, because the bacteria is constantly there, you have chronic inflammation in your mouth. Almost all diseases in your body are inflammation-based. The more inflammation your body has, the more likely you're going to fall ill of a severe illness. Now, there is a debate whether it's the bacteria that is causing most of the problems in your body, or is it the inflammation. Regardless of which one it is, and whether camp you fall into, there is no debate that untreated gum disease will have detrimental effects on your body. The American Association of Periodontology estimates that 75% of the whole population suffer from some form of gum disease, ranging from gingivitis to more advanced periodontitis. In fact, years ago, the World Health Organization stated that 70% of all the population over the age of 30 has some form of gum disease. So you may say, so what's the problem? Well, the biggest problem is chronic inflammation. And inflammation is the body's response to injury. So think about when you get a paper cut. When you get a paper cut, you know, your finger gets a little bit red, it's sore, and that's the inflammatory process. Now, if you think about how that relates to your mouth, think of your mouth having thousands and thousands of paper cuts all over it, because that's what's happening when you have inflammation in your gums, because it surrounds your entire tooth. So if you have gum disease all over your mouth, every single part of that area in your mouth is inflamed. So back to that analogy, think about if you had your hand full of paper cuts, but it's in an environment that you cannot keep it clean. In fact, it's an environment full of bacteria. It's always going to be red and sore. Well, that again is what gum disease is in your mouth. If you don't get the bacteria under control, it's chronically and constantly going to be inflamed. Unfortunately, once you have periodontal disease or gum disease, it's for life. It also means you need to see the dentist more regularly for your cleanings to get all the plaque off that you are not able to get off yourself. There is a lot of research showing a link between gum disease and other inflammatory diseases, such as diabetes, arthritis, hypertension, osteoporosis, respiratory disease, heart disease, stroke, preterm low-weight babies, Alzheimer's, kidney disease, certain cancers, and many more. The bacteria in your mouth, if it's not removed, is constantly being swallowed. Also, if you have gum disease, it's also traveling through your bloodstream. A scary statistic is this: people with gum disease are 7 times more likely to die of a heart attack. Now, there's research now showing that the bacteria that only originates in your mouth, when they do autopsies of people that died of heart attacks, they found that bacteria in the clots that caused the heart attack. Now you think about it, and you know, there's more research that needs to be done to confirm this. But if you got this sticky film of bacteria in your mouth and adheres to your teeth, this stuff, once it gets in your bloodstream, it adheres. And that is now one of the theories, there's many theories, that is one of the theories of why people that have gum disease are more likely to suffer a stroke and heart attack. Now, that bacteria in your mouth, that harmful bacteria, can also be inhaled. And if it gets into your lungs, that'll make you more susceptible to getting pneumonia, bronchitis, and it certainly will adversely affect you if you have COPD. So this has been known for quite a while, but there is 100% correlation between type 2 diabetes and periodontal disease. This is because it is believed that the bacteria in your gum increases the blood sugar levels in your body, making it much harder for your body to control your blood sugar. Now, if you're pregnant, periodontal disease is a big problem because that bacteria in your mouth will get in your bloodstream and it can also pass through to your baby, your unborn child. And because of that harmful bacteria, it has been shown that periodontal disease untreated can increase the risk that you may deliver a preterm or low-weight baby. There has been one case documented of a fetal death due to untreated periodontal disease. Certain cancers, such as oral cancer and pancreatic cancer, are now also linked to gum disease. Research has shown that men with gum disease are 49% more likely to develop kidney cancer, 54% more likely to develop pancreatic cancer, and 30% more likely to develop blood cancers. So again, all of this is really, really scary stuff, but it is the absolute truth about gum disease. As your healthcare provider, we want you to live a long, prosperous life. And a big component of that is having the healthiest mouth that you can possibly have. You should not have bleeding gums, right? Your teeth and gums should not ever hurt. It needs to be treated so you can get back on the pathway to a healthy mouth again. So you have to make that decision of how healthy of a life you want to live. We are always here to help you. I hope you enjoyed our video on the Mouth Health Connection. I'm Dr. Jesse Chai. We'd love to see you smile.